Hello everyone, this is Dr. Lewis Clark back with you today talking about thyroid conditions and how you can diagnose and improve your symptoms with functional health care. So hopefully you've had a chance to see our other three videos in this series and begin to get an understanding of normal physiology, some of the lab tests that are needed in order to diagnose. And today we're going to go into the main part of understanding where the thyroid can go wrong. There's 6 different pathways, metabolic pathways, or breakdown points that can happen in the thyroid normal metabolism leading to thyroid symptoms. So that's where we're headed today, all right? And I want to tell you, first of all, that to recover from a thyroid condition, you're going to have specialized metabolic and possible neurologic treatment, depending neurologic if it's Hashimoto's being the cause of that. And so that's what we do in our office. We evaluate and treat according to what we find from a neurologic and metabolic evaluation. So what does a complete thyroid evaluation look like? Well, you're going to need to have the proper testing, more than just TSH and total T4, although those are necessary. You're also going to need the thyroxine index, free T4, free T3, reverse T3, and I'm going to explain these. Resin T3 or T3 uptake is what is most commonly called, TBG, and of course autoimmune antibodies regarding thyroid, regarding Hashimoto's and Graves' disease. So let's go through why these tests are important. I'm going to show you how to determine from these tests where your thyroid problem is coming from. So first of all, remember that if you have an autoimmune condition, as a patient does that I just dealt with today, and even she told me that this is not a thyroid problem, it's an immune system problem. Please understand that. And she says her frustration is that her medical doctor only wants to give her thyroid hormone, and it doesn't do anything to help the immune system. So the attack and the damage goes on, and then she just ends up with the same symptoms, even though she takes the hormone. And by the way, that's what happens with a lot of thyroid patients. So proper testing is the key, remembering that most of them are autoimmune and that autoimmune is an immune system problem. It results in a thyroid problem, but it starts because of an immune system problem. So number one factor, as I just said. Now let's look at the other 6 major thyroid patterns. We're going to go back and look here at the physiology of thyroid and thyroid hormone. So it starts with the brain and the hypothalamus, and the pituitary turns on the pituitary gland, and then it turns on the thyroid gland. So you could have a brain-based problem resulting in poor thyroid function. How would you know this? Well, because your TSH would be low. But remember, you have to look at the right ranges, as we covered in a previous video. Go back and review that if you don't remember. But if you look at the lab ranges, you may miss that your thyroid problem is resulting from a brain-based problem. And then, of course, you could have a pituitary problem, which could result in also low TSH and even possibly fluctuating TSH, where it goes up and down. And sometimes it might even appear normal, but you need to test it more than once. And then what most people only thing they know about is that you actually have a thyroid problem. And that is possible. You can have, for whatever reason, you can have a thyroid gland that's not functioning normally, so it's not putting out normal amounts of thyroid hormone. But remember, the most common reason why that is happening is because of an autoimmune attack, particularly in this enzyme here called TPO, which is also called Hashimoto's disease. So There's 3 of the 6. We're going to go on down now. We know the thyroid gland produces mainly T4 hormone, that's 93%, 7% T3, and T3 is the active form. So this has to get converted. So in order to get converted, it has to get into the bloodstream and be carried by thyroid binding globulin. So that is the next place where something could go wrong. You could have too much or too little thyroid binding globulin, and that must be tested by the TBG test or also by the T3 uptake test. One or both of those can tell you what's going on with your thyroid binding globulin, which is a protein that transports the thyroid hormone through the bloodstream. So here's the way to remember this. So the hormone is sitting on a protein, and then it's going to get off and go into the tissues, right? So if you don't have enough binding globulin to carry the thyroid hormone, then you're not going to get it to the tissues. But then again, if you have too much binding globulin for the thyroid, then the hormone gets off of the protein, and then another protein picks it up. It's like another cab comes by, picks it up before it actually ever gets to go into the cell. The most common reason why your thyroid binding globulin will be off is because of other hormone imbalances, like too high of testosterone or too high of estrogen. The 5th place where thyroid can go wrong is in the conversion of T4 to T3, in which 60% of that happens in the liver, 20% happens in the gut. So if you have liver problems or if you have gut problems, what will you see on your lab? You will see normal T4 but low T3. So if you don't ever run T3, you're never going to know if you're converting this or not. So it's going to be missed if this is your thyroid pattern or if this is your thyroid problem. And then we've got the last place where problems can happen, and that is actually at the cell receptor. Remember that every cell has to have a receptor to allow the hormone into the cell so it can do its work. If that receptor is closed down, it will not allow the hormone to go into the cell. When this happens, all of your thyroid labs will look normal, but you still have a thyroid problem. So you have to look at other things like blood sugar, inflammation, adrenal function, cortisol levels. These type of things can indicate what is causing the thyroid hormone to be shut down. That is often missed, and people wonder, why do I still have thyroid symptoms even though my labs are normal? And that's the most common reason right there. So this is an overview of the 6 patterns where thyroid function can go wrong. Now, remember that the key is nothing happens until free T3 gets into the cell. And without that happening, you're not going to have anything happen as far as normal metabolism. So what makes what we do in our office different is that, number one, we dig until we find the underlying problem. And then we set a neurologic or metabolic program together to give you some hope. And that is ultimately what we're looking for. I know that you've been through a lot with your thyroid. You're frustrated about it. You're tired of feeling like you're just lazy, or there's nothing you can do, and you can't deal with the weight issues. Your brain fog is bad, your constipation, your depression, whatever it may be. There is hope at the end of the tunnel, and the way to get there is this. You have to ask yourself some questions. Number one, what is my desire to get better? If you don't rate on a 10, then you're probably not going to get better, because you must have the desire and have the big enough why of why you want to be better in order to put in the work necessary to heal your body. Number two, you got to think about what thyroid is doing to your relationships, most of all, your work environment, affecting your finances, your family, and your other activities that you're missing out on. And then, how much has it cost you in time, money, happiness, and sleep? And then you ask, what is it going to look like in the next 1 to 3 years if I don't take care of this problem now. And then ask, what is it worth to me to get this problem under control, get me feeling better, brighten my future once and for all? If you answer yes to that, you want that, then here's the way we evaluate you in our office. There are 2 visits. Number 1 is, and this may be a virtual or this may be an in-office visit, do the complete exam, review labs, do the metabolic assessment form. If you're in the office, certainly want to have your spouse present if possible there. Visit 2, we're going to review the exam findings, neurologic findings, assessment form findings, go over blood work, and if we accept your case, we're going to give you the treatment recommendations, what the financial obligations and investments are, and certainly you want, if you're in the office or virtual, you want to have your spouse available for that report as well. So our normal fee for that 2-day process is $450. I'm doing a special if you see this video and you mention this video when you contact my office. I will do the entire evaluation. I'll even get the labs that you need to have done for just $195. So that's that's almost a $200 savings, and including your labs. So what you need to do is you need to contact our office, and you can contact us through Clark Chiropractic and Wellness.net, or call us directly at 281-354-8330. I want to thank you for taking the time to watch this series, and I look forward to seeing you on our next series. And until then, live life well. God bless.